Hi, it's Dr. Niland. So, as society begins to open up, we've been getting a ton of phone calls and questions from families and parents who want our guidance as to how they and their family should resume moving around in the world again and gradually expanding their social circles and their social footprints. And unfortunately, neither our nurses nor our doctors have 10 or 15 minutes to spend discussing all of these individual considerations with families. And so I am putting together this slide presentation, going outside of my comfort zone. I hate my voice and I hate public speaking, and this is a little bit of all of that. But I feel like this will be a more concise way and a place to direct families to help you create a framework and use some basic data and guidelines for you to make these decisions for you and your family. So first off, just some disclaimers. Every family situation is unique, and every individual's risk tolerance is unique. So we have some parents who call us for all sorts of decisions regarding the parenting and raising and choices for their children. And then we have some parents who we only see the child and the parents once a year when they come in for their well checks. So if you know that you're a parent who typically needs a lot of our guidance to help make these decisions, if you're the parent who needs to call us from the grocery aisle to help you decide what brand of green beans you need to buy for your child, your decision making is going to be different than the parent who we only see once a year. You just have to know what kind of parent you are, and neither is right or wrong or good or bad. You just need to know where your level of anxiety and worry lie, and then you're going to make those decisions from that place. Things that you're going to take into consideration when you're making these decisions about how your family is going to start expanding socially into the world are the ages of your family members, any health conditions that your immediate family and your extended family have, parents' jobs. Are you working from home? Are you able to continue working from home? Do you need to get back to the office to work? Your financial situation, how this has been affected by COVID-19, the mental health of both parents and the children in the home, and then stress levels that people in the home are feeling. So all of this is going to go into you making decisions about your family. We at Step by Step cannot make each of these decisions for you, but we can give you data and basic tools to create a framework for your decision making for you and your family. And we can let you know that the physical risks to children from COVID-19 seem to be very low. So parents are asking us, are you seeing a lot of this in the office? The answer to that is no. We're seeing very little, if any, infectious diseases in the office. But that being said, every day in the office, on the telephone, we see kids whose worlds have been turned upside down. They are all messed up on their sleep schedules. They're on the iPad and their phones too much. They're not playing outside enough. They're snacking all day long. They don't have any routine or structure. And parents who are either working outside the home or working from home are stressed. And so all of these things, you are not a bad parent if you need to consider your stress level, your job, when you're making these decisions for you and your family. So just if you want to not watch any of this and you just want to come here and be like, I wonder what the doctors are doing, let me use that as my guideline. So I'm just going to tell you what our family, Dr. McClellan and I, have kind of where we've gotten and become comfortable with. So we go to work every day and we practice general pediatrics with appropriate personal protective equipment, which means surgical masks, gloves when we need it, gowns when we need it, the more protective N95 masks when we're doing higher risk swabbing and procedures. We wash and clean our hands all day long. We clean our medical equipment. We clean our computer equipment. We have, if you follow the Facebook page, you know that we've put in like 100 new policies and procedures in the office so that we can keep you safe, keep ourselves safe, and keep our staff safe. When we get home from work, we take off our clothes, we shower, we change our clothes. When we are going out in public, like say to the grocery store or to pick up food, we wear a cloth mask. We sanitize our hands frequently if we're like at the grocery store. We have about 3 other couples that during this time we've socialized with, initially via Zoom and then maybe over the last 2 weeks in person, but it's all been outdoors and we've been socially distanced or physically distanced by the way that we've set up our chairs. We do order carryout from restaurants. We have 2 teenage children and we have allowed them to socialize outdoors with some of their friends. They each have a group of maybe 8 different friends that they socialize with. Some people may disagree with this, but our kids are mentally stable right now, and I think that allowing them to safely see a small group of friends has contributed to this. We are taking a driving vacation to a non-crowded location where we will not go out to eat. We're going to eat all of our meals in. When we are spending time at the pool, we're going to physically distance from other pool goers. And same thing when we're on the beach. Our daughter typically goes away to a sleepaway camp for 2 weeks in the summer. The camp has been canceled through June and they haven't made a decision about July. I don't know what we're going to do. She wants to go. We haven't figured that out yet. And then our son had to come home from college from his freshman year, and his university is considering a bunch of different learning models for the fall. We're kind of stressed about that because we don't know what's going to happen with that. But those are the things that we are factoring into our decisions and thinking about when we consider COVID-19. What are we not doing, even though society is now opening up? We have made the decision we're not comfortable eating out at restaurants, either outdoor on a patio or inside a restaurant. We didn't typically go to bars anyway, but we're not going to bars. We are not going to church. We will not fly on a plane for a long time. We are not letting other people inside of our home. Regarding like our fitness regimens, we've been doing yoga via Zoom together at the house, and McClellan's studio is working on getting back to going to in-person classes, but he's going to continue on Zoom. And I go to a different studio. I haven't heard yet how they're going to do things. The type of yoga that I practice, it's a small class in a pretty big room, and so I have to kind of see what they're doing before I decide whether or not I'm going to go back or just keep practicing at home. We do not plan on attending any large celebrations like graduation parties or weddings for the foreseeable future, and we are not crying about Buckeye football. That is a lie. McClellan totally crying about Buckeye football. So what do we know about COVID-19? This is going to be the data portion of the slides to help give you a framework for making your decisions. So first off, COVID-19, this virus, even though it seems like it's been here for an eternity, it's only been around for less than 6 months. And that is like a blip in the timeline of medical science. I mean, there are things that we talk about in the office every day, like say the HPV vaccine that's been around for over 15 years, that has data related to being given to hundreds of millions of people, and parents still believe that that is inadequate science and not enough to make decisions upon. So to think that we know all the answers when this is a novel virus that's only been around for 6 months, we just don't. The information about this virus changes weekly, sometimes more often, more frequently. What we say today may not be what we say in a month. Just to give you some idea of just raw numbers, worldwide, there's been 5.5 million cases with 350,000 deaths. In the US, there's been 1.6 million cases with nearly 100,000 deaths. There's a greater risk of serious disease and death as in older people, so above age 60, even higher risk above age 70, and the highest risk for severe disease and death is in those above the age of 80. And then if you have other comorbid health conditions such as high blood pressure, obesity, heart disease, that gives you a higher risk for severe disease and death. So what do we know about COVID-19 in children? Studies worldwide are showing that kids under the age of 18 make up about 1 to 2% of all COVID cases. And the vast majority, so more than 94% of cases in children are not severe. Few cases in kids require hospitalization, and most cases of hospitalization for COVID-19 are in kids under 1 year of age or in those kids who have underlying chronic medical conditions. Interestingly, asthma does not seem to give an added risk for more severe disease in kids. Strange, because most respiratory viruses, kids with asthma tend to get hit with that a little bit harder. They tend to be in the higher risk age, so higher risk group. So it's interesting that this is not that way. And then you may have been hearing about this multi-system inflammatory syndrome in children, or HIMSS or Kawasaki-like syndrome from the cases coming out of New York City. I think what you need to know is that even though you're hearing that on the news, this is exceedingly rare. So now a little bit of local data. As this is likely the most important data that you're going to want to use as you start to slowly and gradually move about in your neighborhood and your local community. So Nationwide Children's Hospital has been the primary location for all COVID testing for children in Central Ohio. They have only been testing those kids with moderate to severe disease, plus a known or possible exposure to somebody with known COVID or with another risk factor like an underlying health condition. And so they have not been testing mildly symptomatic children. Just for some general numbers, 6% of the positive COVID cases in Columbus have been in kids 0 to 18 years of age. And earlier in one of the slides, you may remember that I said that the average percentages worldwide have been in kids are making up about 1 to 2% of the total cases, and that though includes mild and asymptomatic kids who, different countries and different regions of America are testing different tiers of patients. So our percentage is higher, but you have to remember that we've only been testing the sickest patients. And in total, these numbers are small. And with anything in medicine, we try not to make sweeping generalizations or recommendations based on small data sets. But this is the information that we have, and this is what I'm going to use to help guide you in your risk decision making. So of all these kids that they have tested, there's been fewer than 200 total cases. And so the testing's been going on for 8 to 10 weeks, and there's been less than 200 kids under the age of 18 that have been positive. Less than 20 children during this time frame have been admitted to Children's Hospital. And so just to give you a general framework for relative risk. So there's a virus called RSV that causes wheezing and respiratory difficulties in babies and kids under the age of 2 or so. And in the winter months, it's probably the #1 reason that we admit kids to the hospital. So when you're a resident at Children's Hospital, which is a super busy emergency department, super busy hospital, there would be nights that you would take call for say the respiratory service or the infectious disease service. And in overnight shift, you could admit 12 to 15 babies and infants with RSV. So just again, from a relative risk standpoint, 20 kids admitted over 8 to 10 weeks is a really small number. And then finally, Children's has not treated any patients with multisystem inflammatory syndrome. They have also been testing asymptomatic children as part of their ongoing inpatient surveillance for COVID, as well as those kids who are coming into the hospital for, say, a predetermined surgery or a procedure where they're going to be in contact with hospital workers. And I don't have the total numbers that they have tested for asymptomatic kids, but only less than 1% of those tested in this risk group were positive, and it was a total of 5 children. And this under 1% asymptomatic positive is a rate that is similar to other similar hospitals in Ohio. So how does this help us, and what information does this give us? It lets us know that there is a really small chance of a child walking around without symptoms that they would have COVID-19. But we do have to remember that everybody's been staying at home and sheltering in place. And once we start to move around more, daycares open, camps open, that sort of thing, we don't know what this is going to do to the numbers. But as of right now, there is a less than 1% asymptomatic carriage rate in kids. I will tell you that over the last 8 to 10 weeks, with everybody staying at home, we have seen a dramatic decrease in all infectious illnesses. And so this is going to start to rise as we start to move around more. And I think what we've learned from all of this, and I hope that society at large can learn from this, is that if a person has symptoms of fever or cough, illness, both kids and adults need to stay at home. So we shouldn't be sending kids to daycare or school or camp or the birthday party. Parents shouldn't be going to work, shouldn't be heading to COSI, we shouldn't go to the pool, we shouldn't go to the zoo, any of these places where you're going to come into contact with other people. We need to, when we're sick, isolate ourselves in our house, stay away from other people. That is the safest way to prevent the spread, not just of COVID, but all of these other numerous infectious illnesses. So next topic, are kids little petri dishes and germ factories? And the short answer is yes. So for the vast majority of infectious diseases, kids are vectors, and they spread it to each other, and they can spread it to adults. But for whatever reason, COVID, this virus is interesting and strange and weird, and we don't fully understand it. But most of the studies are showing that kids do not easily spread the COVID-19 virus to other kids or to adults. The majority of children who come down with COVID-19 caught it from an adult who was positive that lived in their household. There is a higher risk of contagiousness if you are indoors in a close space versus being outdoors. There is a higher risk of contagiousness when you have a longer duration of exposure or contact to other people versus a shorter duration. And, the CDC has put out some differing data, and we're really not sure right now how likely it is that we catch COVID-19 from physical surfaces. So it's possible. We don't know how much that contributes. The primary source of transmission is through respiratory secretions, so sneezing, coughing, singing. So indoors, close quarters, close contact with a lot of respiratory stuff coming out, that's your highest risk. So on to specific questions regarding how you can start to expand your world and your social contacts. The biggest question we're getting is, when can we see the grandparents? And again, I can't tell you specifically, our nurses can't tell you specifically. You've got to use all this information for your family to make the decision that is right for you. This is going to depend on ages, on health conditions of your immediate family and your extended family. Where do the grandparents live? If they live in a nursing home, I'm going to say that's not a great idea. Have the grandparents been staying at home and quarantining, or have they been out living their lives, seeing friends, going to the grocery store, doing normal things? Because if they've been living out and about and not being overly strict, then seeing your 3-year-old who doesn't have a fever or a cough is probably pretty low risk. If anybody in the family, either your family or the grandparents, is sick, you should not be around each other. Meeting up outdoors is lower risk than meeting up indoors, and being together for a shorter time is lower risk than being together for a longer time. You got to consider wearing masks, especially if you know that there's going to be hugging and snuggling and unable to keep 6 feet apart. And then everybody needs to be hand washing frequently. Next, is it safe to send my kids to daycare or to day camp? Again, you have to look at your individual situation. How old are your kids? How old are you and your spouse or your partner? Are there any health conditions of people in your immediate household? How freaked out are you going to be when your kid goes to daycare and comes home with a fever that is way more likely to be some other summer virus than COVID? Because what cannot happen is your kid come home with a fever and you call us and you demand to be tested for COVID, and we cannot provide that because the guidelines are not testing kids just with fevers. If you're going to wig out, then you need to think about not sending your kid to daycare or camp. If you're going to be able to get through this and recognize that it's likely some other virus, and even if it is COVID, you're going to treat it the same as other viruses and watch for the same concerning things we always tell you to watch for, then you weigh that in your decision making. Parents who have, when both parents work and you've both been working from home, and you've also been trying to school your kids and watch your kids, and your stress levels are through the roof and your work is suffering, you are not a bad parent if you feel that your family would do better if your kid went off to daycare or camp. So don't feel guilty about it. Look at all of the risk factors and the exposure factors, and you are not a bad parent if you need to continue working from home and your kid needs to go to daycare. I think anywhere that you're going to send your child, you need to talk to the owners or the supervisors or the administrators and see what additional measures they are putting in place to help keep the kids and the staff safe. And then you need to have a process for when you pick your child up as to what you're going to do from a sanitizing standpoint. So hand sanitizer before they get into the car. You're going to get them undressed right when they get home. You're going to hop them in the shower. So you have to just have a plan that you're consistent with and that you're comfortable with. Okay, when can you start having play dates or expanding play dates? When can your kids start seeing some of their friends? So I like this idea. Some people call it social cohorts, or some people call it their quarantine. And so that, I kind of look at that as maybe there's 2 or 3 families in your neighborhood or in your social circles that you know well and you trust, and they've been quarantining at about the same levels that you have. And you feel like those are going to be the people that you're going to let your kids interact more closely with. Um, that shouldn't probably be 10 families. I think that initially I would keep it small. Again, playing outdoors is a less risk than playing indoors. Kids using individual toys or equipment is a less of a risk than them having shared equipment. So going for a bike ride is less risky than two kids wrestling together in the grass. There should not be play dates or kids hanging out together if either or any of the kids are symptomatic with fever, cough. And then there needs to be a plan for hand washing and cleaning the surfaces and shared toys or equipment. Swimming pools. So this is the one that I'm like waiting for our city pool to make its decision because I really want to go to the pool. So what I'll tell you is, again, you have to find out what measures your local pool is taking to allow for physical distancing and added safety. So we live in Bexley and we've had 2 surveys come to us. And if they put these things into place, we're going to use the pool. Instead of there being summer membership, it's only going to be in 1.5 hour blocks. You're going to get a time to go and a time that you have to leave. They're limiting the capacity to, I think, 80 people, and you have to bring your own lawn chair. So those are things that I feel like, knowing what I do at the pool, which is sit in a chair and read my book, and then when it's rest period, I dip in. I feel totally safe being at the pool. Kids are a little bit obviously more active and in the water more and all over the place more, but the actual risk being in the pool, I feel is pretty low. But the risk of moving around outside of the pool and eating at the picnic tables and touching the lawn chairs, like those all sort of escalate the risk a little bit. So you need to take those things into consideration. All right, and then we're just going to run through quickly a whole bunch of other scenarios. And I think in all of these, the main thing you need to remember that your greatest risk for catching this virus is when you have close indoor contact with people that you don't know. So first off, restaurants. Outdoor dining on a patio that has physical distancing is less risky than indoor dining. Bars where people are elbow to elbow, drinking, dancing, shouting, it's high risk. Gyms and fitness studios, I think it depends on the facility. And so I think that you need to ask questions of the gym owner or the trainer or the fitness professional as to what they have done to make things safe and extra clean for the people who are going to be using that. Camping outdoors, I think, is low risk. I think, you just have to distance from families that you don't know. Travel, I think things to take into consideration are you going to drive or are you going to fly? On an airplane, you have far more exposures to people that you don't know. You don't know their situation. When you get there, you're going to stay in a hotel where there's lots of other people versus an individual lodging. You need to avoid crowds. You need to figure out how you're going to get your meals. So those are all things to take into consideration. And then celebrations, I know last week I think the governor said that celebrations of fewer than 300 people are allowed. I don't know, that seems a little risky to me. Large gatherings, if you're thinking about going to them, I think you need to, again, look, are they outdoors or indoors? Are you going to know the people that are there? Do you really have to go? Can you wear a mask? Are other people going to be wearing a mask? Is there going to be a means of hand washing and sanitizing? How's the food going to be? Potlucks with shared spoons and dips, and it just seems like a giant risk to take. There's ways that you can make it safer, but that sounds really risky to me. So in conclusion, what are the main takeaways? We cannot make these decisions for each of you. Your family, both your immediate household and your extended family, your situation is unique, and your tolerance for risk is unique, and your decision-making factors are unique. We cannot make the decisions for you. You need to create a framework that works for you and your family, and you need to go with it. The overall risk of COVID-19 infection in kids is low, but kids do not exist in a bubble, and so you have to consider other family members and other exposures when you're making these decisions. The end of the stay-at-home order doesn't mean that we should all go crazy and run wild. You need to still be cautious. You know, all along we've said you need to be prepared but not panicked, and this stays for this. You need to take precautions, you need to trust your gut, and you need to do you. If you're stressed about this and you're being very conservative and people think you're overreacting, who really cares? You need to do what you feel is right and what is going to help you sleep at night. And then on the flip side, if you see people who are being more open and liberal about their social movements, you shouldn't shame them for that. And then just, again, I'm like a broken record, but indoors is a greater risk than outdoors. Longer periods of contact is greater risk than short. Big gatherings with unknown people is more risky than small gatherings with known, trusted, similarly minded people. So I hope this has answered some of your questions and given you the basis for making the right decisions for you and your family. Keep washing your hands, keep hugging your kids, keep taking deep breaths, and be well.